Welcome back to AM Live, and I'm here with my friend Dr. Ask.
It's good to meet you.
It's good to meet you. It's good to meet you. I am very interested in learning about fluoride because I know a lot of people did not realize out there we naturally do not have fluoride in Amador and Calaveras County.
No fluoride.
No fluoride. So I need you to tell our viewers what they need to do and the importance of fluoride and what it actually is.
Great. Okay. Well, first of all, fluoride is one of the 10 greatest public health achievements in the United States in the last 100 years. So what do you think, what are some of the great achievements in public health the last 100 years?
Well, immunization.
Immunization, absolutely.
Of course.
Okay. And then control of infectious diseases, another one. Decline in death rates from coronary heart disease. Better foods, healthier mothers, family planning. And look at on this list, fluoridation of drinking water.
Right.
So what's fluoride? Well, first of all, fluoride is a toxic waste. Did you know that?
No, I didn't know that.
It's toxic waste.
And I brush with that all the time?
Yeah. It's well, there's a lot of things that will kill you. Water will kill you, too much of it, in the wrong place.
Sure.
Air will kill you in the wrong place. So you have to use it wisely, obviously. And the reason where they found fluoride is, and the effects of fluoride is because in Texas, they had all these people had these brown stains on their teeth. And they go, what's all these brown stains? And so they started investigating. Oh, and as they were investigating, they go, well, they don't have any cavities. Okay? And so they started checking, and they started looking at and they realized it was the fluoride in the water that helped reduce decay. Fluoride, with regular visits to the dental office and a proper dose, okay, reduces decay by 50 to 70%.
Really?
Okay, yeah.
Wow.
So, and what it does is it actually prevents the teeth from sugars to dissolve the teeth. And here, why don't you open your mouth up here?
Right.
This is just one.
This is amazing. This is sugar from one can of soda.
Just one little can of soda.
One little can of soda.
Go ahead and open it.
No, because that's
no big deal.
That is entirely too much sugar.
That's just in a 12. What about a 20 ounce?
Can you imagine?
It's incredible.
And what are some of the other ones you have there?
This is just vanilla ice cream, 1 scoop.
Wow.
This goes on Pop-Tart. But anyway, the soda is what's really the biggest
That is
thing.
amazing.
So
that is amazing.
Okay, so there's no fluoride in the water up here. So
yeah.
we strongly recommend, actually, from my wife when she was pregnant with our kids, we gave her fluoride tablets. And so those tablets are here somewhere. But anyway, it's a little pink tablet. Okay, and actually the cost of a lifetime of fluoride is less than the cost of one filling.
Wow. Now, do you have to get a prescription to get fluoride tablets?
Yes. So your physician, okay, and there's a lot of times there's fluoride in the polyviflors in the vitamin tablets. So a lot of mothers are getting their fluoride in the vitamins, and then the dental offices we can write a prescription.
I'll be darned. And you just take it every day.
Right. Okay.
Now, when you brush with certain toothpaste, like they say that they help fill in and they help do this and that, is that true? Or do you feel that that's true?
If the kids swallow the fluoride, the toothpaste, that's the best thing they could do.
Really?
As long as they're not being supplemented with additional fluoride. Okay?
Oh, okay.
So I normally don't recommend toothpaste unless the kids are swallowing it. A little bit, of course, not a lot.
But now with little ones, though, a lot of parents don't bring them to the dentist until they start losing their baby teeth and they start seeing their permanent teeth come in. That's really a fallacy. You need to get those kids to the dentist when they're really very, very young.
Absolutely. We actually encourage the parents to bring their children with them. It's sometimes a little chaotic in the dental office, but that's okay. And it gets them used to it. It helps them. We have fun with the kids. We actually help them assist. They actually get in the assistant chair, and we help them. In fact, this last week we had one do that, and then she told her mom, I want to be a dental assistant when I grow up.
See, I think that's great.
Yeah, that was fun. And parents care about their kids. I mean, there's naturally they want. And so with fluoride, actually, by providing fluoride is one of the best things that you can do for your kids and help them have their teeth for a lifetime. So,
absolutely. Okay. Absolutely.
So, okay.
Now, I wanted to ask you another question.
Okay.
Pregnant women. They use fluoride toothpaste. Is that enough to help when the in vitro?
No, unless they swallow it.
Okay.
It's what you take in that's going to make a difference.
Okay, so if you're pregnant, then it would be a good idea to have a fluoride supplement.
Absolutely. Yeah,
and that helps start the baby.
Right.
Developing good, strong teeth in vitro.
Exactly, because the baby teeth are developing. Now, the other thing is I see a lot of parents that at the age of 3 or 4, they stop giving their kids fluoride. Okay?
Right.
And so we recommend all the way through age 14 or 15 or 16.
Right.
Okay.
Right. But if you buy a toothpaste that has fluoride and you get your family used to brushing every day, twice a day.
Toothpaste has nothing to do with what we're talking about. I'm talking about ingesting the fluoride.
So you have to ingest it.
Swallow it, yeah. Okay.
Uh-huh.
So I don't recommend toothpaste. I haven't used toothpaste for 25 years. And we talked about that a couple of weeks ago here on this program, actually, about what is in toothpaste that really doesn't do really any good. Okay.
Now, in the old days, they used to use like baking soda, and that's abrasive.
Just water.
Just water is sufficient?
It's totally sufficient. In fact, you do a better job
with just water
because you can see what you're doing. So, okay?
And floss.
And floss, of course.
Because that's speaking of dental health. When you have bad teeth and you get sick, your mouth can really make your bodies ill.
Absolutely.
Especially like abscess or things of that nature. That sends a toxic poison through your whole body.
Absolutely. We'll talk about that on this program in a couple of weeks.
Good.
Okay, about
Good.
that. Okay,
Good.
So there's no fluoride in the water naturally. There's so many different water systems. There's actually a law in California now that if you have over 5,000 hookups and the money is available, that the municipalities have to fluoridate the water. Okay. The way the water agency here it's just very difficult to fluoridate the water here. So for parents of Amador County, recommend definitely see your dentist, get fluoride supplements for your kids.
Okay. Now, is there some way that you can? Is there anything over the counter that parents can buy?
No, not with fluoride. It's prescription only.
Prescription only. So we have to do that. Yeah. Boy, our segment went by too fast.
Thank you. It's good to see you.
It was wonderful, and please keep coming back because we need to have dental education. It is very, very important. Okay. With that, we're going to run over to Mr. Camster. Thank you, Doctor. I appreciate that.